Thank you, Jonathan. I feel like I'm taking the baton and moving forward. My lecture today is going to be talking about the many uses of ozone. I am not going to be describing and giving you the protocols for all these things. My purpose is to show you in the veterinary practice how many beneficial ways we can be using ozone every day in our practice. Here are the most common applications that I use in my practice: major autohemotherapy, rectal insufflation. We lavage ears. We do it in our dental work. We always lavage the mouth if we've taken teeth out or if we have any ulcerations in the mouth, lavaging wounds, inflating ozone into the bladder, whether it's the straight gas or it's using ozonated saline into the bladder. Abdominal lavage, where we literally take ozonated saline and lavage it into the abdomen. Minor autohemotherapy, rinsing eyes with ozone, giving it subcutaneously, using it as acupuncture, and also prolotherapy with or without the PRP. So this is an example of rectal insufflation. Next to major autohemotherapy, it's the most common way that I use ozone in my practice. Some of the cases we'll use ozone on is the ADR case. And for you who don't know what ADR is, it's ain't doing right. So an animal that just comes in and you're really not sure what's going on, but you want to do something to make them feel better and boost the immune system. Vomiting, diarrhea. Anytime you need to increase the immune system, ozone is a great application. So a lot of times we put ozone into the rectum and go, well, is it really doing anything? So here's an example of light field microscopy on a dog. This is the red blood cells before we did the rectal ozone. And we can see that there's a lot of rouleau and aggregation. The cells don't look very pretty. And then 10 minutes after we did ozone, the red blood cells totally changed. The fourth phase of water is affected, the cells separate, and even though we don't make any claims based on live blood analysis, we certainly can tell that these cells are going to be able to function and do their metabolic job way better than the cells previous. So this just helps us to see it really is doing something in the body. This is a dog that we were injecting using minor autohemotherapy. Took a little bit of blood, mixed it with ozone, and injected into some skin tumors that this dog had. And within 10 days, we saw these tumors shrinking. Now, when I do ozone therapy, it is part of a program that I do. I don't believe that there is a pill for the ill or a tool or a diet for the disease that really is a standalone in most cases. There's more than one thing that got us sick. There's more than one thing that's going to get us out of it. These are the 5 keys to healing that I do for every single case, whether it's a healthy animal coming in that I want to keep them thriving, or it's an animal coming in with health challenges. We start with number 1. We teach the owner how to stop polluting that pet's body through diet, water, environment, EMF, everything that we can expose the toxin insults, how they're coming in. We teach the owners how to stop that. The second thing we do is we provide the essential nutrients. These are the ones the body has to eat because it can't manufacture it on its own. So we make sure that we're providing the essential nutrients that the body needs to do its job. Our third step is to make sure we're healing the gut. Those tight junctions, we want to tighten them back up and improve the cellular communication between the microbiome and the mitochondria. Our fourth phase is detoxification, and we detoxify all 6 organs of elimination: the kidney, the colon, the lungs, the liver, the lymphatics, and the skin. And ozone plays a major role in detoxification. Last but not least, it's all about the mitochondria. At the end of the day, if you're not producing energy, you're not able to heal. So we focus on how can we do mitochondrial biogenesis? How can we make more mitochondria, and how can we get them to be able to make more energy? And as Jonathan showed you the Krebs cycle, one of the jobs that ozone does is to increase the amount of oxygen coming in, helping the Krebs cycle to work faster and thereby making more energy through the mitochondria. So let's do some cases now. This is Rufian. She is a 8-year-old female intact who presented to an emergency clinic for acute vomiting. She wasn't eating. She was ADR. She had some blood in her urine. And they did not do any blood work on her. They did do an ultrasound because their number 1 rule out was an infected uterus. And they did not see an enlarged uterus. So they put her on some anti-vomiting medications and sent her home. Well, she came to me 3 days later doing a lot worse. We did our blood work, and her white blood cell count was 47,000. So my first thought was, well, maybe they didn't either see the PIO, or maybe they didn't know what they were looking for. So being as thorough as I am, we told the owner we needed to do a abdominal ultrasound, have it read by a board certified radiologist, x-rays. Of course, we just did all the blood work, and see where this 47,000 white count was coming from. And so glad we did this great workup, because she did not have a pyometria. This dog had a kidney stone in the left and right kidney, but on the right kidney, that stone had moved down into the ureter and had totally occluded the ureter. So here you can see, this is where this stone was stuck inside of here. We sent the dog to the University of Florida. They were not able to save the kidney due to the cost that they were going to charge the owner to remove the kidney. I told them to come back and I would do the surgery. When I opened her up, this kidney looked like a fountain of pus coming out of it. It was just shooting up out of this kidney. So we got the kidney out. We had all of this purulent material in the abdomen, and we did extensive lavaging with ozone. And when she recovered, she did get a little bit of pancreatitis, but it only lasted for a couple of days. And this dog was fully recovered in 7 days, back to eating. And I can tell you for a fact that there's no way that this dog would have recovered that quickly without the benefit of ozone sterilizing her abdomen. This is a case of a dog where we were taking, this is cat, sorry, and we were taking out a bladder stone. Anytime I open up a bladder, I always go back in and lavage this with ozone as well. This was a dog that came to us with a Pseudomonas infection in the bladder that was resistant to all antibiotics. This dog had been paralyzed, and the owner was not able to fully express the bladder and get all the urine out, so he was constantly having urine retention. So we did 2 ozone injections where we went right into the bladder through the urethra, and the Pseudomonas infection was gone. Well, I wanted to see if the owner was expressing the bladder well enough, and we took an x-ray and sadly discovered this dog had an osteosarcoma that was quite advanced. Probably was missed because he wasn't weight bearing anyhow or walking, so you couldn't tell that he was limping on that leg. Anyhow, he had another good couple of months of good quality of life. We did continue doing ozone therapy on him. The bladder infection never came back, and eventually it was time to say goodbye, but he had real good quality of life until that time. This is Ratchet. He was a 7-year-old male dog that came to us with a diagnosis of splenic lymphoma from a referral center. The owners did not want to go through regular chemotherapy. So here is his ultrasound at the referral center. You can see the spleen is very enlarged, and all these black holes are where he had infiltration of lymphoma. This was his live blood before we treated him. It was really sludge. And this was his live blood immediately following 1 hour in our magnetic resonance machine. We continued doing therapies on him 2 to 4 days a week. This was our live blood at 3 weeks. And the whole time we kept seeing him feeling better and better and better. At the 10-week mark, his parents wanted to re-ultrasound him and see how we were doing. And this is his Facebook page. He also has his own Instagram page, and he is quite the hero. So here he was coming in to have his ultrasound done and see how well he was kicking cancer to the sidewalk. And we did his ultrasound, and he had a perfectly clean spleen, no evidence of cancer. And we did have a board certified radiologist verify the pre and post. It has now been almost a year, and Ratchet is still cancer free. He's actually over a year. This is Chakari. She came in with a squamous cell carcinoma, also from a referral center, and the owners did not want to go the traditional route with her. The referral center gave them a very poor prognosis. So we began our whole 5-step process like we do for all of our cases. And here you can see the lesion. She's in the sauna. She's getting her IV photobiomodulation. She's in a ion foot bath. In May, the lesions got kind of ugly looking. You could tell there's something was reacting in there. It started to extend into the other nostril. And by July, this is 16 weeks into therapy, all evidence of cancer was gone. And we are now coming up to a year later, and she still has no evidence of cancer, and she's doing phenomenal. This is Tucker. He is a Great Pyrenees. At 4.5 years of age, he started limping on his left front leg. The referring veterinarian diagnosed him with an osteosarcoma based on radiographic findings. He had swelling. He was getting lysis of the bone. We followed him through therapies. Within 2 weeks of beginning therapy, he was weight bearing, feeling better. We had changed his diet and did all the normal things that we do in our practice. We could see the lesion getting a little bit larger as far as lysis goes, but clinically he was feeling way better and no limping and no pain in the leg. We continued doing therapies on him. Here he's getting his IV photobiomodulation after his major autohemotherapy. And in January, we took follow-up radiographs, and the radiologist confirmed for us that the lesions were literally resolving. This is an osteosarcoma. And by April, we saw almost 100% of healing. That was April of 2019, and he is still cancer-free. That's our handsome boy, Tucker. This is Prowler. She came to us with an advanced liver cancer from another veterinarian office, and we began the same protocols. Her parents were a little limited on how much time and finances they had, so we treat her on the average of once a month. And we just did her ultrasound a few weeks ago, and according to the radiologist, there is no evidence of any liver cancer present any longer. And here she is. Her parents own a gym, so she works out with everybody in the gym, and she is having amazing quality of life. Let's move into some skin diseases. This is very common for most of our practices. This is Holly. She had come to me after being treated by multiple veterinarians with massive amounts of antibiotics, steroids, immune suppressive drugs. Oh my gosh, this dog had everything thrown at her. And she still had these awesome craters all over the outside of her leg, the inside of her leg, and her entire ventral belly and back were covered, and she was incessantly itchy. We did biopsies and cultures, and the diagnosis came back as an allergic dermatitis. We did our protocol on her, and within 2 days, her itching started to go away. And at 3 weeks, she was fully healed. We used no steroids on her. We used no immune suppressive therapy, but we did have to use antibiotics because we cultured 2 bugs that I had never heard of before. She was totally resistant to everything else, and she has been a fabulous skin case ever since.
So 2 quick questions that I'm going to pose to you before you move on. One, has ozone been used to treat equine melanomas that you're aware of?
I don't treat horses, so can I defer that question to one of the equine?
Oh, wait till later. This one, do you find that the biophotomodulation symbiotic to the ozone therapy?
Oh, 100%. Absolutely. And we can do that one during the Q&A because we also use photosensitizers. They're specific drugs that have specific light frequency activations. So we do the ozone, we do high dose vitamin C, then we do the photosensitizers, and then we do the photobiomodulation.
Okay. Great. And one more quick one. What would be the treatment protocol for sarcoids? Any thought on that?
I'm going to defer that because I have not treated a sarcoid. So
okay,
I'll defer that one.
We'll wait on that one. Thank you.
But what I will say is implement those 5 steps that I covered in the very beginning. You cannot simply use ozone and continue the same lifestyle practices that got that disease where it is. And I don't care if it's allergies or cancers or whatever it is. We have to look at the lifestyle, the diet, the water that they're drinking, the toxins in the environment, the lack of proper nutrients. All of these are hugely important, even the detoxification, because we find in a majority of our cases that their organs of detoxification are just so overwhelmed, they're not working. So we go through and we clean it all up, and then the body is able to actually respond. So irregardless of whatever the disease is somebody asks me about, I will always refer back to those first 5 steps. Do the foundation that allows the body to heal. Cool? Okay, I'm going to move on. We all see a lot of chronic ear infections, and we do a ton of ozone lavaging in the ear, followed by a photobiomodulation with the blue light. We use the multi-radiance laser, and so we'll use the blue light to aid in killing bacteria and our 50 hertz to aid in stimulating repair of that tissue. This is an ear cytology, and I don't know if you can appreciate this, but all of this debris out here is bacteria. This was a 5+ rods in this dog. This is 36 hours later, no bacteria present. We did not use any topical medications that we sent home with the owner. We did ozone flush 2 days in a row and laser 2 days in a row, and the infection was gone. This is Rocco. He came to us having been to his regular veterinarian for this head tilt that was a progressive head tilt. It started out with an ear infection, and he had chronic skin disease his entire life. He was a rescue dog, and they had gone to a referral center, and his head tilt was getting worse as more drugs were added on. So he came to us, we did our major autohemotherapy, we did lavaging of the ears and the rectal insufflation the next day. Basically what I did is I focused on helping to remove the inflammation. That was my goal, not to treat the symptom, but to remove the inflammation. Here he is immediately following his first treatment, and you can appreciate that his head is markedly straighter than it was on presentation. 3 treatments. Oh,
real quick, you might want to turn your volume off on the videos if possible when you play those.
I can't.
On your computer. Okay.
Yeah, I can't. So here he is on after 3 treatments, approximately 10 days later. His head tilt is totally gone. He's feeling phenomenal, and the owner was beyond ecstatic that for the first time in this dog's life, his skin was cleared up as well. This is Ritz, 14.5-year-old Jack Russell Terrier. And he presented for an acute onset of circling and head tilt. Now, in a 14-year-old Jack Russell, I think all of us would be concerned about cancer as our first brain tumor. And he had a bad ear infection. So we did our cytology. We flushed the ear with ozone. We put him on in our magnetic resonance machine. We reset his parasympathetic nervous system, and we lasered him. Ozone I already mentioned, and he got a chiropractic adjustment. And this is him 24 hours later. Literally the next day. And what I want you to appreciate is most veterinarians probably would have made this dog better. But with ozone, the speed of recovery is phenomenal. I mean, we're talking hours to a few days, our cases respond. This is Oreo, 7-year-old male neutered kitty cat that came in for vomiting. The owner saw him eating a plastic leaf off of a plastic plant that she had, and she thought that he had a foreign body. But when we did our workup on him and we did x-rays, ultrasound, and blood work, we found that he was in kidney failure. His phosphorus was elevated. Specific gravity was still 1020, so we had a little kidney to work with. Started him on fluids, ozone, all the normal therapies that we do in our protocols. And in 36 hours, which was basically a day and a half, his creatinine and BUN were almost back to normal. And 1 more day later, his blood work was back to normal and has remained normal ever since. Took him a couple more days to get back to eating well, but he is doing phenomenal. This is a dog that had an argument with the other dogs in the house, and we were getting ready to do surgery, and we went, whoo, there is our jugular vein. So if you've never seen the anatomy of the jugular vein with everything else stripped away from it, we can replay that for you. So we did lavaging, we did rectal insufflation, we treated him on a daily basis with rectal ozone and with the laser, and had a few other products in there. This was one of his cuts. So he's laying on his back. His eye is here. This is his eye, his ear, and this is the ventral part of his neck. We had a drain tube in, and there was another big laceration over here. Here he is getting his treatment. And that was a really traumatic tear. And this was looking like it was going to bruise pretty badly. As we did his treatment, every day, all the bruising went away. The healing was ridiculously fast. And in 10 days, he was totally healed, took the stitches out, and not 1 stitch dehisced. What was even more remarkable was the next day, he was eating and appeared pain-free, moving around, and we just avoided the other dogs in the house. But he healed phenomenal. This is Max. He's an 8-year-old male neuter dachshund, and he presented to us because the owner's son was babysitting Max while the owners were out of town, and Max developed a skin infection that the son was not able to control. So he brought Max in, and as soon as I put some water to Max's back, it just sloughed the skin and the hair. We did biopsies and cultures and histopath, and it turned out that Max had gotten sunburned. The Florida sun is very hot. He was left outside for over 7 hours without any shade, and his whole back became severely sunburned. So every day he had major autohemotherapy on the day one presentation, but then every day he had lavaging of his back. He went in our salt booth. We had a lot of topical treatment. He was on antibiotics, hypochlorous acid rinsing, rectal ozone on the subsequent days. We rinsed him with ion, gut health, topically, silver, poly-MVA. And in 2 weeks, his back peeled off. And I know that might be a little gross, guys, but appreciate how beautiful this granulation bed is. This is the next day after his back peeled off. And this is 1 week later. We're continuing working with him and using collagen. And there he is, fully healed with the blueprint of Florida. Here we are in Florida, United States, on his back. This is Chloe. She's a 15-year-old female spayed Chihuahua that developed a deep corneal ulcer. Here we go. And we tried to give the owner some surgical options. She did not want to put Chloe under anesthesia, so we chose to do topical lavaging with ozone and to do laser. We came in from the side and we were doing our laser therapy. 4 days, her ulcer was totally healed. Now, I don't see that kind of healing in young animals that get ulcers in their eye. It's really remarkable. This is
so real quick. When I pop up, that means I have a question.
Okay.
So it's going to go back a couple cases. For Oreo the cat and renal failure, how was the ozone used? You don't need to go back, but
okay, I'm sorry. We did major autohemotherapy initially, and on day one, along with lymphatic therapy, ion foot bath, and then we did rectal ozone the next day. So he was back to normal in 36 hours, in 72 hours.
Great, thank you.
Mm-hmm. So this was Dazzle. Dazzle came to us for humane euthanasia because when the owner saw her that morning, she had something really stinky, and she looked at her rear end and it was just covered in maggots. And so we decided to convince the owner that we could actually treat this. And so we flushed with ozone and then we lasered. And in 48 hours, all the maggots were gone and her tissue was healed. 48 hours. And she lived a long time after that. This was Luna. Luna was a 1-year-old Yorkie who at Christmas time chewed through an electrical cord and electrocuted her tongue. The owners did not know what she did at the time. All they knew was that there was a poop sample on the floor and she was profusely drooling after she made some loud yipping noises. This is the tip of her tongue. This is over halfway back in her tongue, and we see this massive ulceration, and it was another pocket in here, a pocket in here, and a pocket in here. There was only a little tiny sliver of tongue that appeared to be unaffected. It even burned through the commissure of her mouth. If this would have continued to burn all the way through her tongue, obviously we would not have been able to save her because she wouldn't have the ability to eat or drink. So we started her on hourly rinsing of silver, of Luma, ozone, orally and rectally. We lasered her, the lymphatic therapy. Within 24 hours, she was eating and acting like she felt good. And this is 1 week later. It never burned all the way through the tongue. This part was absolutely normal, and she acts like nothing ever happened. Snake bite cases. I'm in Florida. We actually caught a water moccasin in front of our office last night. So we have a lot of snakes, and you can see the amount of swelling here. We use anti-venom, rectal ozone, and laser. And here she is 36 hours later, no swelling. I've been practicing almost 40 years, and I've never had a therapy that can make the swelling go down as rapidly. And she never felt bad either. It was pretty cool. This is her blood on presentation. If anybody wasn't sure it was a snake bite, those are the hallmark echonocytes. And here was her blood 18 hours after therapy, back to normal. This is another snake bite that we just got in earlier this month, just to demonstrate the amount of swelling. And 14 hours later, no more swelling. And they killed this snake, so they knew it was poisonous. This is a dog who had presented to us for a severe vaginitis, and it went all the way up her belly and inner thighs. She had been to the University of Florida. They put her on 2 courses of antibiotics, and she got a little bit better, but it really didn't go away. She came down to us, and I was determined to find the underlying cause as well, which it turned out I was in the hyperbaric chamber with her, and I saw a few drops of urine leak out. So I realized, even though it was not in her history at all, that she was probably having some urine scalding. So we kept her hospitalized for a 10-day period, and we were able to heal this without any antibiotics, just using ozone rinsing, laser, silver, hyperbaric, hypochlorous acid, etc. All the protocols that we do, I'm happy to share later, just don't have the time in this presentation to give you the variety and go over the details.
No, that's exactly what I was going to say, is there's only a couple minutes left, just the FYI.
Okay, so this is Pistol. She had gotten into a fight with some litter mates and had a big hole. The owner was not able to get it to clean up. We used laser and ozone in our magnetic resonance, and within a period of 5 days, we got this thing fully healed. Bon Jovi was a dehorning gone bad, so the owners were not able to get this lesion to heal. We did our ozone and our laser, and within 3 days, it was fully healed, and he went home. This was Fred. He was coming in with abscesses under his chin. We lasered it, lanced it, ozone flush, and he did really well for a long time. A little deer that came in with a broken leg, we wanted to help stabilize her and boost her immune system before she went to rehab. And so we did all the therapies on her. This is Sammy. She had come in because she had an acute paralysis, went to a referral center, was told that she had lymphoma in her spine and they should euthanize. Owners did not want to do that. This was her 4 days into our therapies, including major autohemotherapy. This is her 4 weeks later. She is now 3 years down the road and still doing well with no relapses. This is Kim. Also was paralyzed for over 5 weeks, did not have the money for surgery. She came to us, and using our protocol, we had her standing in 4 days, and then we just got to see this cute thing. It was actually less than 14 days, but I didn't get any video of her until 14 days, so being authentic. Cute. Prolotherapy, just want to cover these. This was Zeke. He was non-weight bearing on that hind leg after rupturing his cruciate. This is immediately following prolotherapy and PRP, fully weight bearing, and has been ever since surgery. Rudy also was not able to use his leg. This is immediately following his therapy, and this is a week later, really using the leg well. Sometimes we have our old patients, which are just ADR. This dog was 18 years old, couldn't lay down at night, couldn't sleep. Owner couldn't sleep because the dog couldn't sleep. So we saw her head pressing in the videos, and she just was very disoriented. But the owner wasn't ready to say goodbye. We did our workups. She had severe spondylosis. We did our entire workup on her. And this was the message I got from my owner. After our therapy, she was able to sleep for 8 hours, and she had another wonderful month with this dog before it was time to say goodbye. Beavis, feral intact male, presented for upper respiratory tract infection. We used ozone in our salt therapy and changed his diet. In 24 hours, he was feeling a lot better. 72 hours later, 100% clear of the virus and has had no relapses since. Popcorn had some GI disease, long-standing GI problems. We used our ozone. This is just lymphatic therapy, the before and after effects of what lymphatic therapy does on helping the immune system. Here he is getting an ion foot bath. Brave me to take a white dog and put him in an ion foot bath, but it did wash out. These are the last couple cases that I think are so important to look at. Abby came to me when she was 2 years old. She'd been to several veterinarians. They could not find a diagnosis for her, but she wasn't thriving, lethargic, not eating, chronic vomiting, and diarrhea. Through an extensive workup, we were able to find out that she had a hepatic shunt. Sent her to the University of Florida. They determined she had no portal vein, so she was not a candidate for surgery. Told the owners that she was not going to do well. This is her video 2.5 years later. She comes in every month, and she has her rectal ozone and her lymphatic therapy. Of course, she's on good food and supplements, and she is still thriving 2.5 years later. That's her before and her after picture. Bobby on the right is another hepatic shunt. This was a probably microvascular shunt. We diagnosed him when he was a puppy. He came in for routine blood work to get neutered, and his ALT was 799. And after all these years, he comes in on a regular basis, and we are able to keep his ALT under 200, and he's thriving, never had a day of feeling bad. So I am out of time. I do want to make one point though, and that is in regards to time. You know, we're all in an interesting time of the world right now where we have a lot more time than we ever thought we were going to have. And time is the most valuable asset we have, but yet we tend to waste it. We kill it, we spend it rather than invest it. And that's what our clients are asking us for. They want quality time with their pets. And ozone is one of those tools that allows us to give them that. So thank you very much. I really enjoyed presenting that plethora of cases, and I hope it's inspiring for you as a practitioner to be able to incorporate into your practice as well.